Hi, everyone. Welcome to episode 3 of Dentist on Air. Today we have a special guest, Dr. Daniel Edwards. So hang in there, we will be with you.
Please fasten your seatbelts.
So, welcome everyone to another episode of Dentist on Air. And this is Flying Dentist, and today we have a special guest, Dr. Daniel Edwards from University of Michigan, whom I had the pleasure to be his student, I think since 2023, if I'm correct. And I let him introduce himself. Dr. Edwards, welcome to Dentist on Air.
Thank you. Thank you. So, Dr. Dan Edwards, born and raised in Michigan. And I was, pre-dental, probably, mid to late in college. So I was always pre-med, but pre-dental was kind of took the forefront after I did some shadowing and evaluated, what I wanted to do with my life.
Yeah.
So ended up going to the University of Michigan for undergraduate and college. That was 4 years, and then stayed another 4 years for dental school. And then I can talk about a little bit about this later, but did a GPR general practice residency for 1 year at Loyola University in Chicago. And I stayed a second year because I liked it so much. And then I stayed 3 more years as faculty and taught at the program and helped run the program, was the assistant director. But during that time, excuse me, my wife and I got married and wanted to end up back in Michigan. So we moved back to Michigan from Chicago and settled in Ann Arbor. And so that was 2002, long time ago. So I've been teaching ever since 2002, and then been in private practice as well. So I have two boys. One is graduating from college. He's a senior at University of Michigan, and he is not going to be a dentist. And my senior in high school, he'll be graduating in a month and a half, and he is also not going to be a dentist. But he'll be actually going to Loyola Chicago for undergrad. So back to my roots after dental school. So that's really cool.
That's very fun. That's very fun. I have questions about that intro. But hey, welcome to Dentist on Air, and thank you for accepting my invitation. I always appreciate your support. I used to appreciate as a student, and now as a colleague, you're always a mentor to me, and I learned a lot from you. So it's really an honor to have you here in my newly established podcast. Um,
Thank you.
I'm gonna go ahead and start actually my questions because something triggered a new question in my head when you were doing the intro. I didn't know actually you were a pre-med. I thought you were a pre-den. So that was interesting. And now, you mentioned that none of your kids are gonna be a dentist. How does that make you feel?
Yeah. So, in college, being pre-med slash pre-dental, pre-health, um, I really weighed the pros and the cons of being in medicine versus dentistry. And I think lifestyle wise, it was right up my alley as far as dentistry is concerned. I think we have great one-on-one patient interactions. It's an opportunity to run a business. I think the care in general, I'm a people person. So I love working with people. And while I would get that in medicine, I felt like dentistry was probably more appropriate for me. So I'm really glad I went the dental route versus medicine. And, as I look at my boys, the senior at college, he was good at science, but he didn't enjoy it. And I
Yeah.
feel like you need to be good in science to, want to go to dental school or medical school. And same thing with my younger son. I think he like science, and it's okay. Probably less than my older son, but he's definitely doesn't want to be a dentist. So as a dad and as a mentor to them, I want to make sure that they're happy with their careers, their lifestyles, the choices that they make. And if they don't want to be a dentist, that's okay. I want them to be happy and have filled lives with joy and pride in what they do. So it's okay that they're not going to be
Gonna be a
in the dental
dentist.
profession.
Oh,
Yeah.
that's very sweet of you as a dad. Yeah, today I was thinking to give some information to the newly grad dentist, and we discuss how it's going to be a dentist, in the real world after school, and how it's going to be the business like. And that's why I brought up that question with you to ask, how do you feel if, your own kids are not going to be a dentist, or what kind of, goals or examples do you want to set for your kids and like even the dental students that they're going to graduate soon, and like on what should they expect to choose dentistry as a profession? You know what I mean? Like, because I feel my experience has been different, like in different countries, of course. But the real world to me was different from the school environment. And that's what makes me think that we maybe share information, exchange information, and get your experience on it. And if you have also any guidance for the newly grads to graduate, and what are they going to experience? So I'm gonna hold myself because my experience has been different from you, and I know you have, mentored and raised generations of dentists after one after another, and you have been in touch with them, probably got their experience too. When did you actually graduate from dental school?
Yeah. So I was 93 from Michigan and 97 from Michigan Dental School. So
Okay, so
it's coming
97.
up. Yeah, so coming up on 30 years. And then, as I said, during the GPR program, I did that for a couple of years and then taught, but then moved back to Michigan in 2002. So this is my 24th year
Yeah.
teaching. So I've had 24 years of
So you
dental students.
constantly did the teaching, after being a dentist, right? You enjoyed that. But
Yeah,
did you had your own clinic as well in Chicago, or were you only
I did not. No,
okay?
no. So during the GPR program, I taught, but I also saw my own patients. So most of the time I was seeing my own patients, and then I would also do a study club for the residents, as well as review treatment plans of their patients and
Yeah,
oversee their patient care at the
yeah.
same time that I was
So you were a
patients.
full-time
So
faculty, and that was
yeah,
3 years, right?
yeah,
Yeah,
full-time faculty, 3 years.
yeah. And
Mhm.
then you moved back to Michigan. Did you then open your own practice?
Yeah. So, one thing about Chicago that I want to mention, um, doing a GPR AGD, I feel like gives you really, really great training and experience beyond what you might get, say, in the first few months or year of a private practice. I'm very pro GPR and AGD. So you have a patient setting, it's a clinical setting, but also still kind of an academia or academic setting, and you have provided faculty and co-residents that you can still learn from. So, there are some states in the country that require residency programs for general dentists, and then most
Hmm.
don't. But if you're kind of waffling between, yeah, should I do one or not? I'm very pro because I think I've gained a lot of my confidence and experience during my GPR
The
program.
GPR,
And whether it's
yeah.
yeah. So whether it's a GPR or AGD, I think it's an advanced year of training, and you're just going to be more confident going into private practice. While it's not required,
Hmm.
I definitely encourage dental students checking into them. So,
Fair enough.
so back to your question.
Yeah.
Uh,
Oh,
and
and
so
I'm sorry I'm cutting you. For real listeners who don't know what is a GPR, it means General Practice Residency, and AEGD is Advanced Education in General Dentistry. So usually it's some sort of a residency for dental students that will go into after being a GP just to advance their skills, I think.
That's right. That's right.
Yeah.
And GPRs are usually hospital based.
Yep,
They
that's
could
true.
be a regular hospital or a VA or Veterans Hospital. And AGDs are typically dental school based or clinic based,
Hmm.
and they are usually outside of a hospital setting, but not
Yeah.
always. There's some hybrid programs.
Yeah.
But yeah, so it's not required, but definitely, advanced training is definitely a plus. So
Plus.
yeah,
Yeah.
so moving back to Michigan,
Hmm.
I actually was looking for a job. It was, a tough market, and I did not want to open up my own office. I really, I didn't have any private practice experience. I had been in an academic setting for 5 years, so I wanted to join a practice, whether it be solo practice or group practice. And I just kind of stumbled upon a practice accidentally, actually. Ended up doing a working interview, which was a 1 week time, and then landed that job. So it was outside of Ann Arbor, where I live now. My wife and I moved right back to Ann Arbor, but it was about a 25, 30-minute commute in
Hmm.
another suburb community. And it was a big group practice. So no, I didn't. I joined a private practice, but it was full time. But as I stated, I also taught part time 1 day a week at the dental school in Ann Arbor. And then the other days, including Saturdays, worked in a private practice. And I did that for a
Hmm.
couple of years.
Nice. So at that time, that will make it 19, wait, 2000 or 1997?
So, yeah, so 97 to 2002
You were
was
teaching,
the
right?
residency
Yeah.
program.
Yeah. Yeah. Okay. So 2002 was okay.
Yeah, so starting in 2002
Okay.
to 2005, I was in that large group practice. I actually thought, this larger practice isn't for me, and I can talk about that in more detail. But I thought I wanted to join a smaller practice, so I actually joined a different practice in Ypsilanti, which is adjacent to Ann Arbor,
Yeah.
for 1 day a week. Plus, I taught, so I was actually had three jobs and three practices. Which a piece of advice for new dentists graduating, when you're not sure of the practice style that you want, whether it's solo
Hmm.
practice, small private practice with maybe a partner, or large group practice, I would encourage, new grads to check out each of those types of practices to
Hmm.
see what best fits their style. And maybe it's, working in two different offices and just, learning about the flow of each office, and the pros and the cons of a large office versus a small office. I learned a ton of what I liked and disliked. And so during that 3 years, 2002 to 2005, I
Hmm.
was working in those, teaching plus those two other
Yeah.
locations. And I want a smaller office. So
Yeah.
in 2005, I built Oak Valley Dental Associates. I started a practice,
Hmm.
and I had two partners. We had a brand new building, a brand new office, and an existing patient pool already coming from the other two dentists.
That's
So,
nice.
yeah, so
Yeah.
that's been now open over 20 years.
Nice. And I hear you're very successful in it.
Very successful. Uh, well, success can be defined in many different ways, right?
Yeah.
I'm very happy with.
Do you feel successful?
I do. My cup is full. I feel very, very happy
That's what
with where I
matters,
am.
right? I think that's what matters.
Very happy, yes, in my career. So,
Yeah.
opening up an office in 2005. When you open an office, you don't know how it's going to go. Are
Yeah.
patients going to come? Are patients not going to come and see you?
Yeah. The
So,
no shows.
and we are out of network. We're a fee for service
Hmm.
office, which
Yeah.
means we don't participate with any insurances, and we'll file insurances for the patients, but otherwise, it's all fee for service. So that's a little scary too, but so glad we did that because we don't have the write-offs that a lot of colleagues do,
Yeah.
and yeah, so.
Fair enough. So, follow-up question. When you were looking to Actually, two questions. You can answer it together, I think. Um, what made you not do clinic and only go for academia? Um, you know, just teaching at in the GPR. And then second, when you finally started to go back to the, business side of dentistry, did you look into DSOs? Were DSOs a thing at that time, or was it just private practice?
Yeah. So the first question, I've actually always wanted to be a teacher my entire life. I think I was in elementary school, and the neighborhood kids would come over, and we'd, be in our backyard or in our patio, and we'd be playing. And I always demanded to be the teacher. I was going to be the teacher, and all the other, including my brother, the neighborhood kids and my brother, they were going to be the students. And so I would always give assignments and, grade the papers and, and give tests and,
You had a passion for
let them,
that.
yeah, let them out for recess. So I've always, really wanted to be on the teaching side and mentorship side. So
Yeah.
that just comes natural to me. I believe I'm a natural mentor.
Mhm.
It's what I get great joy out of.
I approve that.
It it's really what makes my week run well,
Yeah.
that I get to mentor, dental students every week. So anyway,
Hmm.
going back to the origin, in elementary school, I always wanted to be a teacher. So it was natural for me after dental school to join the GPR for more learning, but then to stay on as faculty and enjoy teaching because I taught at the resident level. So I dabbled in, looking at private practices in Chicago. And again, the market was a little tough. So it was very comfortable setting for me to stay at Loyola at the GPR program
Yeah.
and teach. And, I really enjoyed those in total 5 years of teaching.
Yeah.
Yeah, then transitioned to Ann Arbor in 2002, and it was pretty natural for me to jump into the dental school and start
Hmm.
teaching. So they uh, adjunct
So
clinical
that part you were
faculty.
100% sure. Like you wanted to have the
Yeah,
teaching no matter what.
I was all in. And, the advantage of moving back to Ann Arbor was living in Ann Arbor. The dental school is in Ann Arbor.
Yeah.
So it was a natural transition for me. So they hired me, right away. Again, just one
Hmm.
day a week, but teaching in the clinic and mentoring dental students. But at that point, I knew I didn't want to do full time academics, as far as being at a dental school or even
Yeah.
the GPR here at University of Michigan Hospital. So that's when I explored private practices. And, DSOs weren't as much of a thing in 2002.
Hmm.
I would imagine there were a few out there, but I was really checking into more private practices.
Hmm.
From what I heard, DSOs now are growing about 1% every year. I don't know if that statistic is true or not, but if that is the case, back in 2002,
I
it
think.
wasn't an opportunity.
Yeah.
Yeah, it was on my radar.
Yeah.
So
So, then your options were either to, buy a practice and be the owner or be an associate, right?
right,
At that point.
right.
Yeah. And then, which one did you prefer at the time?
Yeah. So in 2002, when my wife and I moved from Chicago to Ann Arbor, we were going to buy a house, and the market actually was really good. It was a buyer's market at that
Yeah.
point.
Good
So
old times.
not ev- yeah, not everything was overpriced.
Not the $5 per gallon.
No, no. So we bought so we put a down payment on a house, bought a
Yeah.
house in Ann Arbor, and we didn't sell in Chicago, so I didn't have a ton of assets. So buying into a practice right away financially was not an option for
Option.
me. And
Hmm.
yeah, and in addition, I think, at the time I wanted to live and practice in Ann Arbor, and I didn't really have any opportunities. I interviewed with some offices in and around the area, but ended up, about 30 minutes outside. So it was both a financial barrier to
Yeah.
buy into an office and also just didn't have an opportunity.
Fair enough. When you began your career in that practice, What was, the biggest challenge for you in the first 3 to 4 months?
Yeah, that's a good question. So I was in a large group practice and had never been in a private practice setting before, which is
Yeah.
common for new grads.
Mm-hmm.
So I considered myself almost like a new grad,
Yeah.
where I wasn't in private practice and I didn't really understand the flow, but at the same time, I had about 5 more years of experience during the GPR program. So during those first few months, I'd say some of my pitfalls were just understanding the flow of a private practice and doing hygiene exams plus managing my patients during while I was in this group practice, I would actually run dentistry out of two different rooms. I had two
Mm-hmm.
assistants.
Yeah.
So it was very busy. While I was finishing up one procedure, my other assistant was seating the patient, and I would, hop over into the other room, and then I'd check one or two hygienists. So it was much busier than the flow of the office I came from in Chicago,
Mm-hmm.
which was more academic setting. So I'd say some of my, immediate pitfalls were just kind of keeping up.
Mm-hmm.
I was very grateful that they kept my schedule busy. But at the same time, I just wanted to make sure I kept up and did, still good
Yeah.
dentistry. So,
And that
yeah,
is a very, I think, important point, doing good dentistry. And I love that you brought that up. That was for me, I mean, practicing in the US was a different animal for me. Totally different thing. Um, in Iran, it's just not a common thing to have like 12 ops or 10 ops, and then run from one room to one room, have two, three columns at a time where I used to practice. So this was new to me. And, running and getting booked, like having three columns and going from room to room to room. If you don't have a good team, first, I think that's very essential. You're going to fail. If you don't have good trained assistants or front desk that's going to support you, um, you can't manage it just all on you. And at the same time, I love that you brought that good dentistry thing because not everything is about production. Not although it kind of is to some level, I think, because the business side matters. And if you don't produce, you're gonna fail. How are you gonna pay the salaries of your staff? How are you gonna pay yourself? You know what I mean? But at the same time, you don't want to compromise the quality, the at least the standards. I'm not saying like spend 2, 3 hours on a filling, but make sure that contact is there. Make sure there's no overhang. Make sure, you know what I mean? The occlusion is accurate, at least the basic checks. Um, so yeah, doing good dentistry is very important. And I feel me as newly starting in the US, um, I felt that anxiety that I have to produce, that I have to do that for job security, for the sake of paying my student loans, for a lot of things. And then at the same time, I felt bad. I was like, am I rushing it? Am I doing bad dentistry? And I love that you brought that up and that you set that example for yourself, back even. And it's something that I think all new graduates should kind of like set that model for themselves as well. Because at the end of the day, it's our license. And then
that's right.
if anything goes wrong, it's on us. You know, they're not going to ask, oh, why why did your assistant do that? Why did your front desk do that? It's you. It's your responsibility. It's your liability.
Yeah. Yeah. And, to speak to the whole group practice thing and the pressures of producing, the practice that I joined in 2002 was 19 rooms. There were four general dentists working all out of two rooms, and I think 6, 7 hygienists. So,
Yeah.
it was a well-oiled machine. It was very high producing.
Yeah.
What I appreciated most is that the owner dentist didn't put a ton of pressure on me
Hmm.
to produce, like some offices could. They wanted me to do good dentistry. They wanted me to treat their staff and their team well.
Yeah,
And
it's very nice.
internally, yeah, which was it was a very comfortable setting. So I
Hmm.
really appreciated that. But, as at the dental school, we hold high standards for dental students, right? So when you are a new grad and you go out into practice, you have to keep those high standards for yourself. And you want to try to always, do the best you can under the circumstances. And when
Hmm.
dental students ask me, hey, I have, these two opportunities, what are your thoughts? And sure, finances and the reimbursement and paying back loans are one thing, but also, are you going to be able to do good dentistry, have high standards, keep your good morals and ethics, and just do the
Hmm.
best you can? Because at the end of the day, yes, it's your license, but it's also, you have to make sure you feel good about what you've done that day with your patients.
That's
So
very
that is,
that's a very good advice, I think.
all
Yeah.
about the patient.
Yep. Yep. If you actually make your patient happy, or if they actually feel, I feel as a clinician that you care for your patients, you're going to be successful. I think no matter what. Like, um, maybe it will take a bit of time, but I think if your patients trust you, that's a whole different level of success. Like the money will come. That's at least how I think, or ha has my experience been. Um, because there's this vibe that I kind of like even patients can have picked up on, that they think they're just gonna get charged, or they're just there for us to make money out of them, but that's not true. I feel if you actually show them that you care. And I actually got a comment from one patient one time, and because I was like, oh, why are you not doing a filling on this tooth instead of that tooth? Like this tooth is way worse. Like, and if you lose your molar on this side, your bite on the right side will collapse. So why do you want to, put money on your front tooth as an example? I don't remember what was the case exactly, but I was like, if you lose that tooth, you can't eat on that side. That's gone. And then, some patients have limited funds. And then the comment and feedback I received from the patient shocked me, because she was like, "Oh, you actually care." And I was like, "Okay, that's very alarming." That a patient tells me, "Oh, you actually care," because her experience. And then when I talked more to her, she was like, "I went to so many practices, so many, dentists all around, and then I never felt that they care." And that's I think kind of alarming.
Yeah, I think, you bring up a good point about trust. You and I are patients too, right? Like we go to a physician,
Yeah,
we go to a physical therapist, we go
exactly.
to the doctor, and we want to have trust in our healthcare providers, and we should look in the mirror and say, hey, we want patients to trust us. And part of
Just
that
us.
trust
Yeah.
is showing that you care for the patient. I think one thing that I've learned over the years is sometimes patients just want to tell their story, sit down and tell you, whether it's about the history of their dentistry or the history of a certain tooth, and they're just looking for a healthcare provider that's going to listen. And so
Hmm.
over the years, I've much better listener. And I think that patients value that. And, they value the fact that we're listening and that we're hearing them.
Yeah.
And I think it all plays in the story of providing good care for them, is
Yeah.
that we are good listeners and provide that for them.
Yeah. No, that's very important. And um something for me in terms of listening, and you brought up a good point, is that what I learned is the patient's chief complaint. I feel that's mostly their why did you come to the dentist today? Like, what is your main concern? Um, and I feel, and I've, started to ask that question, like, after, oh, hi, how's your day? Welcome to our practice, blah, blah, blah. my next question is always, okay, what brings you in? Like, what is your chief concern? What is your chief complaint? And then they kind of open up. Oh, I'm here actually for this tooth or for that. I want this taken care of. And you may see 100 more things on your exam, but if you don't address the patient's chief concern, they're going to lose trust in you. At least that has been my experience because they feel that you don't listen. You're just going to do whatever you want. You recommend other things or things. And then if you don't address that chief concern, you're not a good listener.
Yeah, I mean, there's a reason why we put what is your chief complaint or chief concern on the health history or dental history. The
Yeah.
patient writes something in there or types something in there, and yeah, we should address that.
Address that.
And yeah, if we may not be able to address it at that appointment, but at least we
Yeah.
can look at it,
At least to
talk
offer a
about it,
plan.
and offer a plan.
Yeah.
And if it's not in our priority wheel and we see it that way, then I think letting the patient know and giving them all the information that they need as to why it might not be my priority,
Yeah.
that's when I listen and then I discuss with the patient and I have them, they make an informed decision because they know
Yeah.
all of the choices and options and they know what the treatment plan is.
Plan is.
So
No, yeah, that's very important. How long did it, so, for me, I think it took me around 5 to 6 months to adapt to the real world coming out of school and find a sweet spot where I can keep my patients happy. I can, be happy with myself, like with the dentistry I'm doing, do ethical dentistry, and also do business, you know, a sweet spot to balance all of them out. How long did it take you? I mean, you had way more experience because you did the GPR before, starting that position in Ann Arbor. But how long did it take you to find that sweet spot for yourself?
yeah, it's hard to say a timeline to be honest, because like you said, I had the clinical base that I practiced in Chicago for about 5 years.
Hmm.
What I didn't understand or didn't know was the business of dentistry, and that's
Yeah.
when I started opening my eyes to, oh yeah, well, a patient doesn't show up,
Yeah.
or a insurance claim gets rejected, or
Yeah.
that
Narrative.
yeah, those things I think are that took me a while
Hmm.
because I was very sheltered in an academic setting, and while we had to be productive, I also it wasn't the main focus. So, and being
Okay.
honest, the dental offices are a business, right? So
Yeah,
we have to pay attention to the business of dentistry as well.
exactly.
So
Yeah.
yeah, so I would say, those first couple of years of being an associate, so it was about 3 years, I learned a lot. And then in
Hmm.
2005, when I opened my own office, I had two experienced partners, and opening an office is a whole nother,
Oh, I
can of
know.
worms. There's a lot to it,
Yeah.
from the design of the office itself and the finances to, opening the first day.
Hmm.
Um, that took a while to kind of get in a rhythm and understand, opening up a new business.
Yeah.
So it's difficult for me to put a timeline on it. It takes a while. It's not going to be
Yeah.
anything short.
Yeah. So, did you ever set up a goal for yourself, like financially, as a dentist, to be like, oh, I have to make this amount of money for myself?
Hmm. Yeah, during residency, I was just happy to pay the interest on the loans from dental school. So my goal was just pay the interest, and if I can put a little bit more towards it, awesome.
Yeah.
But I set a goal 10 years that I wanted to have my loans paid for.
Yeah.
Well, my loans back in the day were probably not as much as loans are now, or outstanding balances.
Yeah.
I made that 10-year commitment that I'm going to work hard. I'm going to take a few less vacations, maybe, not eat out as much or not
Yeah.
go to Starbucks,
Yeah.
drive that really, really nice car, and I'm going to pay this off because I
Yeah.
don't like personally having debt held over my head.
Mm-hmm.
So I set myself a goal of being financially successful, paying off the loans in 10 years.
Mm-hmm.
So I didn't, I'm sure back in the day I did the math. I don't remember the math now, but it
Yeah.
was something that was really important to me to put behind me.
Yeah, that's a very good point. I remember nights that I just couldn't sleep thinking about how much I owe in student loans myself. That's a good goal, I think, for people to have. I mean, it's subjective from person to person, but I think that that's a good financial goal to have, as well. Um, just a random question. Okay, I'm gonna bring it up. If you see I mean, it is again subjective, case by case, but do you have a general rule in, say, if it's a three surface, I'm gonna do a crown. If it's less, I'm gonna do a fill. Like if you see a MOD on a premolar, would you crown it or would you do a fill?
Yeah, I evaluate the healthy tooth structure that remains, right? So buccal cusp, lingual cusp of a premolar. If one of the cusps is thinner, then I will discuss with the patient that a crown or onlay or whatever it may be might
Yeah,
be a better long-term offer, and it's a discussion that I have with the patient. So I don't have any hard and fast rules or
yeah,
measurements, but there are a lot of factors that go into, do I do a filling or a crown? Does that patient clench and grind their teeth? Are they a bruxer?
yeah,
Do they have any, acid wear or any previous wear on their teeth from other factors?
yeah,
So while there's, a lot that goes into it, each case is so individualized that, again, being in a fee for service practice, I am not an insurance driven,
person.
provider.
Yeah,
So
yeah,
that's right. We do what's best for the tooth and what's best for that patient, and the patient again
yeah.
um, is informed of all their decisions
Hmm.
and our choices, and then they can
Yeah.
help me make a decision.
That's a good point. The type of practice I think you're in, um, that's a different thing. And I kind of find it sad sometimes. And as much as I think I personally am trying to avoid it, but at the end of the day, some patients like the treatment plans is kind of, I feel, dictated by the insurances, which is not right in so many ways. I even like I just give you a couple of examples. Patient needs SRP, and then after SRP, they need to do 3 to 4 month maintenance, but the insurance doesn't pay. They just do two times per year, and I'm like, that's the standard of care. But the patient has no other choice because they can't pay out of pocket. So now the treatment plan is dictated by the insurance. You're not going to get your 3 to 4 months maintenance, or yeah, and so I honestly I feel if no dental insurance exists, and it would be a better world. I was recently at the Salt Lake City AAE meeting, and I attended the lecture of Dr. Purnima Kumar. She's the perio chair in University of Michigan. I call her a perio god, but one of the great mentors and people I worked with as well. But one thing that she mentioned in her lecture was like, don't say dental insurances. She would say, just say dental benefits. We all have dental benefits. There's a very, very important difference between a dental insurance and a dental benefit. Because as an insurance, you have to feel insured in so many ways, and then it's not that's not the way it's working in the business right now. It's dental benefit. You have some benefits that you may or may not be able to use, but you don't have actually the dental insurance. And I love that she brought that up. So anyway, going back, Do you think that the dental insurances in the future will continue to exist? Well,
Yeah,
actually,
that's a good question.
I should not use that word. I have to correct myself. Do you think dental benefits will continue to exist?
And, I don't know if that's the first time you heard somebody say, don't say dental insurance, say dental benefits. But over my almost 30-year career, I've heard that so many times. Uh, yeah,
For me, that
everybody
was the
thinks,
first time I ever heard, and I loved it. I was like, okay, that's so
no,
accurate.
yeah, you hear it quite a bit when you're at a CE course or just talking to, colleagues or going to a practice management course. Dental benefits, that is definitely is very, very common to mention that. And I think, bringing the topic up to patients, um, and explaining it in a way that it is a dental benefit. It's
Yeah,
not going to cover everything. And, going through the options of a treatment plan. And so, for example, maybe an onlay would be a better restoration and more conservative compared to a full coverage crown.
yeah,
But quite a few dental insurances or benefits that it's not a benefit and they don't cover anything.
yeah.
So between a rock and a hard place where, okay, I could do this really large filling that's covered. That's a dental benefit. I could
Hmm.
do dental crown, a full coverage crown that if we predetermine that it is a dental benefit, then sure, you get that benefit. But being more conservative and going in the middle, it's not covered. So
No,
it's not a benefit.
yeah.
So
What do you
yeah,
think
so
is the right
then
thing to do?
right, so then you're stuck, right?
Yeah.
So that's being open and honest with that patient
Hmm.
and having them, help you make the choice of what's the best for that tooth. A lot of times patients, they would say, Doc, what would you do if this were your tooth? I mean, I hear
Yeah,
that
a lot.
every week, every week. What would you do? And I tell them, I say, I treat you as if you're my wife, you're my family member, you're my cousin. I want to do the right thing for the tooth and the right thing for you. And this is what I recommend. So, and
Hmm.
it may be something that insurance would cover and be a benefit, and it may not be.
Hmm.
And ultimately, it's their decision.
Yeah. So just leave up to the patient. And that's what I try to do as well. Um, Sometimes patients ask me, make that decision for me, doc. I'm like, I can't. I just honestly can't. I can tell you the pros and cons of each treatment. I can tell you if I do a large MOD filling on a premolar, upper premolar specifically, um, or I can do a crown on that tooth. And I'm going to tell you pros and cons, like if it's going to fracture in a year or two or not, like what is the probability? But I'm not a magician, you know? I can't predict what's going to happen in the future. I can make that decision for you. And another video I recently saw on Instagram, I think it was Dr. Miguel Stanley. He was on his social media channel. He was like, anything you buy from the market, TV, car, um, refrigerator, anything, a Rolex watch. I've never bought one, so I don't know. I don't know how accurate is that, but um, they have limited warranty, like a year, 2 years, 3 years. But for some reason, people think that the dentistry we do should last a lifetime. And I don't know why that concept exists. And for anything you do, honestly, a filling, a crown, but I feel it's important to discuss with patients the pros and cons, like what we think may happen in the future if we do this, or if we do option A, if we do option B, and but at the end of the day, they need to also understand we're not magicians and that we cannot predict or make that decision for them. Um, do you have anything to
I
add
think
to that, Doc?
just say you do a big filling,
Yeah.
and like you said, you have no idea how long that filling is going to last. But if the patient has chosen to do that larger
Yeah.
filling, and you've discussed the options of doing a crown, then your job is done.
Hmm.
The patient makes the final decision, and will certainly, you don't want to do something that you know uh, doing a large filling, for
Yeah.
example. uh, if I really think it needs a crown and the patient's really hesitant,
Yeah.
I will say, what I don't want to happen is do a large filling and then you break this tooth in a way that I actually can't fix
Can't
it, and then
restore it
you have to
anymore.
get the
You have to get it pulled
yeah you
out.
have to
Yeah.
get, and that happens.
Hmm.
That happens. So you have to be honest and open with the patient, and if they know that that could be one of the results, then again they're informed.
Exactly. Yeah. Making an informed decision. Yeah. And that's what matters. Um, One thing that I think is also good for the new grads if they listen to this, um, coming out of school, I heard that, well, the feedback that I got from faculty, including yourself, was that my notes are very thorough. Um, Sorry, I had to hang up. I'm gonna go back and delete this part. Um, so a comment that I got usually in the school from faculty, including yourself, was that my notes are very thorough. And I heard from practitioners that as you start to practice, your notes will start to get shorter, shorter, and shorter as you go into practice. That's a thing that I heard. But to be honest with you, as I'm practicing, like it's been a year almost, and my notes are getting fatter and fatter. Like I see things, I read about things that and I discuss more. I document more. Now like I discuss almost try to the at least the major and most treatment risks. And I give you an example. The anesthetic we use in dentistry, the lidocaine, articaine, whatever we're injecting, especially for the IN, for the lower jaw. I recently read about a lawsuit from these malpractice insurances that they commonly send in newsletters. So it was a simple, simple filling that we may do every day in our practice for a tooth, a DO, for let's say tooth number 29. The doc gives the anesthetic and does the filling. Everything goes well. It's a 30-minute, 40-minute appointment. Patient calls the next day and says, I don't have a sense in my tongue on that side. What happened? And I mean, I know there are things that can happen. They're like that can be rare, but I think some things are really important to be discussed and documented. There's always a risk of nerve damage, with any anesthetic injection, especially a lower IAN. We follow guidelines, we follow landmarks to do it correctly. But there's also anatomic variation, and what if the needle goes through that nerve? I don't know. And then something happens. There's always the risk that's involved, which is very rare again, but that can happen. And so anyway, this dentist gets sued for that and then loses the case simply because he did not verbally discuss this risk with the patient. Although it was written in the consent and the patient has signed. And so the attorney brings up the claim that no, oh, although it was, mentioned in the consent that the patient signed, it was never verbally discussed with the patient. And he loses the case because now it's not informed consent. And just reading about that, it got me. I was like, oh, wow, I didn't know that. Like, do you discuss any with every patient that you give anesthetic for like a simple filling? I didn't used to do that. And I started doing that. I'm like, hey, just briefly, it takes me 10 seconds, 15 seconds. This is a risk that it was involved in your treatment consent. Do you have any questions about that? And the response I usually get, they're like, oh, no, we know it can happen. But now I discussed it. And I put it in my notes. I'm like, I did discuss the risks involved in the treatment, including this. It's like a general statement, even for filling. So how has your experience been? Has your notes, increased over time or shrinked? Or do you discuss use of anesthetic like risks or other risks with your patients? And do you have some general tips on that?
Yeah. So anybody who signs up for malpractice insurance, you like the malpractice insurance that I have, if you take a malpractice class, it's about every 3 years. That malpractice class will give you somewhat of a discount towards that malpractice insurance
Insurance. Hmm.
because you're going to a CE class, learning about cases like you just brought up,
Yeah,
and things you should be documenting verbally, written, and things that you should be doing to decrease your liability. Right.
exactly.
So
Yeah,
so I take that liability class or
class.
malpractice class and get a discount based on the insurance that I have. And so I would say my notes haven't gotten shorter. I don't think they've gotten much longer, but I know what you're talking about. I know the
Yeah,
trend where a patient comes into an office and what's documented is number 29 DO, 2% lidocaine, 1 to 100,000 epi given, A3 composite,
composite.
um, check
Check
occlusion.
illusion, patient satisfied.
Yeah, well, there's a whole lot more that went into that.
Yeah,
There's an assistant that's in the room. There is the type of anesthetic that you gave and the type of block, whether it's an IAN or mental infiltration or local infiltration. Did you have an incident with that infiltration or did you not? So I always document, with or without incident.
yeah,
Um, I document how the patient or how the appointment went for the patient. Patient satisfied with filling or patient
yeah.
satisfied with crown. So yeah, my notes are still pretty lengthy.
Yeah.
Um,
I think that's a good thing.
uh,
I think that tells that you're a good dentist.
well, I don't. It doesn't hurt. Everything is online, and I have a pre-written
Yeah. Templates.
note and
Yeah,
yeah template that is just modified. So it's not that hard. But
I
I think
agree.
some dentists may be complacent or get lazy,
Hmm.
and I don't think there's any complacency or laziness that it would be tolerated, especially with liability. So
No, I
uh,
think that's a part you should not mess with at all because I feel if anything goes wrong, God forbid, we're all trying to do our best and do good dentistry. But if anything goes wrong, I feel I believe actually I think it is the only thing that will protect you is your notes. So
yeah,
I feel the shorter you write, the more risk you're putting on yourself and your future and your
yeah,
career. So
exactly.
so another advice
And
for listeners, if you want to practice for a good amount of time, do good notes.
yeah, and something on that topic that I wanted to talk about was we as dentists and healthcare providers, we're not perfect, right?
No.
So while we do the best dentistry we can given the situation, we may not have the best or optimal results for that tooth or for that cleaning or whatever it is.
Hmm.
But I found that being open and honest with the patient is the route to go, and
Hmm.
they know humans. They know we
Yeah.
make mistakes. They
Yeah.
know that we're not perfect. So if you're not happy with that number 29 DO result and you're not happy with the contact or the margin,
Yeah.
you evaluate the situation based on that day at that time. And if you can replace it right
Hmm.
away and get contact or better restoration, great. If not, you sit the patient up and you say, hey, I did my best, but I didn't get my best result today.
Yeah.
I want to read this for you. I want to have you back. There's no charge for it. The
Hmm.
one thing is that it's an inconvenience for you because you do have to come back. But would you let me have another opportunity
To
to do
correct it.
this the right way?
Yeah.
Absolutely. Because why risk sending that patient home with an open contact or a subpar result, and then they get food trapping in there, and then they come into their next hygiene appointment and say, "The new filling that you did, doc, I'm trapping food all the time." Well, you kind of knew that because you checked it and you didn't have that
You didn't have
contact.
that
So
contact. Yeah.
you just, you do the right thing. You do the right thing for that patient and for that tooth, and you have them back and you redo it. So I think
Yeah.
being honest with patients, they continue to gain that trust that is so important between provider and patient.
Yeah.
So
No, that's a good point. Um,
yeah, and that decreases your liability
yeah.
because it may be something as minor as a contact with a filling, but it may be something else that didn't go exactly right,
Right.
and
Hmm.
getting the tooth or something is leading down the road to something more serious, and then
Yeah.
that patient's like, well, this all started when you did that filling or you did
Yeah.
that crown.
Yeah. Yeah.
Like, yeah.
No, fair enough. Um, my next question, what was your most challenging patient? Like what scenario was it and how did you handle it?
Yeah. So over the 30 years, I've had a lot of dentistry that I've done, right? And there comes a time where, you're doing your thing in private practice and fillings and crowns
Hmm.
and whatever dentistry you're doing, and uh, it becomes way easier because it's more routine,
Yeah.
right? Things
Bread and
become
butter.
very yeah, it's the bread and butter. It's very straightforward.
Yeah.
It's not necessarily that challenging anymore. I think one of the things that I love is I have a highly anxious patient that comes into the office.
Yeah.
I've had a few where they're literally crying in the waiting room, just
Yeah.
thinking about going back and to my treatment room and doing the filling or whatever we're doing. So I love converting those anxious patients to patients that trust you
Yeah.
and that will not leave you, and they will not like, I'm never seeing another dentist ever
I
again.
know.
So because you kind of won them over. So I've
I
had a
think it's
handful of those
very
patients.
rewarding for you to believe in yourself and it will boost your confidence as well.
Extremely rewarding. So, while some of our colleagues may see that as, oh God, I'm going to see this patient and it's probably not going to go well, and I hope they don't stay a patient. Like, that's not an attitude that you should have, because this patient really has a built-up dental fear and phobia, and their anxiety is real. So I love
Yeah.
winning those patients over to convert them to actually come in. They're not crying in the waiting room anymore. While they may not look forward to coming in, they at least they tolerate the dentistry that we do for
Yeah.
them. So I
Yeah.
love that. So
No, that's very
um,
nice. Hmm.
and over the 30 years, I've had certain circumstances, whether it's a location of decay on
Yeah.
fifth distal buccal or distal lingual, something way sub G, or I've had plenty where the patient doesn't want to hear that they're in my top 10 hardest fillings or hardest. I'll joke with them and say, I don't want you to be in my top 10, but let's just think positive, and I'm going to do my best.
Yeah.
So while I've had plenty of challenges with certain circumstances with the location of decay, or an anxious patient, I think overall I do the best dentistry that I can
Yeah.
given the situation. So, and I also
Yeah.
set expectations from the
Mm-hmm.
beginning.
Mm-hmm.
So I just told a story recently. I had a
Yeah.
new patient. I was running on time, but she got to the office about a half hour early, so she wanted to be seen, and we just didn't have the availability, and I wasn't available.
Yeah.
So we took her back to the room about 10 minutes early. I started the appointment reviewing medical history and dental history and medications and just the normal. Well, it was a little too much talking for her. And she said, well, doctor, when is my cleaning? And I said, well, this is all very important information to gather because I'm going to put together a treatment plan, based on my findings today. And you're actually spending an hour with me for reviewing everything, a treatment plan, x-rays, all your needs. And then you spend an hour with my hygienist. And she said, well, I don't know if this is going to go that well because I just wanted a cleaning today. I didn't
Yeah.
really need all that.
Mm-hmm.
And I said, well, again, it's important to establish as a new patient. So I get to know you. I like to get to know my patients and I want you to get to know me. And she said, well, at my last office, my cleanings took about 20 minutes and then I was out the door. And I said, well, again, you were informed that this was a 2 hour appointment. And she's like, yeah, I'm not sure this is going to work for me. And the kindest way I said, I'd have to agree. I don't think this is going to work out for me either, because I do have, a flow to the appointment and to the office and a high standard of care. And I guess this isn't just going to be a good match, you and I. But that's okay. There's no charge for the appointment today. I wish you well. And if you need emergency care, because legally we have to provide emergency care if
Yeah.
they're an
For 30
established
days,
patient.
right? Yeah.
Yeah, exactly. Then I'll see you, but otherwise I'll assume, that you'll have found another healthcare provider. And we hadn't taken x-rays or anything at that point or formed a treatment plan, but it was just, from the start, setting expectations with your patient
Mm-hmm.
and a difficult scenario, but I certainly felt like it ended well.
Yeah.
And I didn't get upset and she didn't get upset and she was going to be happy going somewhere else.
Yeah. No, that's a good example. I think I feel because setting expectations from the beginning with your patients and then being honest with them on hey, this is the way I work, but this is the standard of care. When in the beginning I started to take it a bit personal. Like, why are patients so, attacking me? Why are they doing like that? Why are they talking to me like that? But it's not you. It's mostly them. And you should not take it personal. And the first thing that really got into me was a patient that asked me, "Can you just do a regular cleaning?" Like, and I keep explaining, no, you need scaling and root planning because of this. And then the patient looks at me and just says, but I just want the regular cleaning.
Yep. Yep.
do,
That before.
do you get that a lot?
No, I think, my hygienist and I are good at explaining the type of cleaning that they need, whether
Yeah.
it's scaling root planing,
Yeah.
you know, uh, debridement or just,
Yeah.
yeah, regular.
Regular
I
cleaning.
think at screening patients. But I will comment on that. Sometimes patients come in and they've been watching social media
Yeah.
and they ask me about a procedure or a material or something that they've seen that might be trendy, right?
Mm-hmm.
And I would be a little bit cautious as a provider to jump on that trendy bandwagon, right? Like
Mm-hmm.
if you're seeing something advertised or you're seeing some type of dentistry on social media, I wouldn't necessarily just
Go
jump
ahead and
in or
apply it.
provide that patient, right? You can certainly be curious about it and explore and research it, but because if a patient wants it when they come in, or if you see it, oh, another dentist is doing it, maybe I should be doing that too. I I I think there are a lot of social pressures, and social media has
Mm-hmm. Mm-hmm.
accelerated.
Yes. And then sometimes it becomes a competition. We're like, oh, I'm going to lose patient if I don't do this. But no, I feel we should always remember that as clinicians, we are supposed to practice evidence-based dentistry. So if it's not evidence based, if it's market based, doesn't necessarily mean that you can go ahead and, do it. You should not. Um, yeah, so because again, it's your license, your liability, and you should make sure what you're doing for your patient is beneficial to them and not harming them. Short run and long run, period. Um, well, yeah, this was a very good talk so far. Um, I know we have been talking for almost an hour, which is very nice. I'll probably have to invite you back for a second episode sometime soon because I feel you have a lot of good advice to give. Um, my first two episodes, when I started this podcast channel, I wanted to focus on not only dentistry but self-improvement, anything that can improve a person or a dentist or in our field on many aspects, like in the social life, in the clinic life. Um, and so I started with the social media with a person, Tony, that Tony Berardo, that actually motivated me to do podcasts and mentored me on what to buy, what to do, what software used to edit, and he actually invited me on his podcast, I think around 2 years ago, which I really loved it. And I was like, oh, I'm going to do my own channel. So yeah, we had our first episode on that. And then I wanted to take a more dentistry approach a bit to it. After all, it's called Dentist on Air. But then, the whole world started going upside down. So my second episode ended up being about something that I was not planning, which was the war on, Iran and US and all of that. Having, experienced both sides, I thought it would be nice to talk about it. But you're my very first guest in the dental field and in the dentistry. And I really loved what we talked about. So, and you know, as this thing is also new to me, the podcast world, um, I'm exploring myself as well, like to see what I like to talk about mostly. And what we did today was really catchy to me. So I really liked it. Do you have any advice, any point you want to make to the newly grads who are coming out of school, going into this business world, with all these patients' liability and all of the anxiety and all of that? I personally went through a lot in adjusting to this real world. Um, and I know that I reached out to you a lot of times asking for help, asking for your mentorship, because it didn't stop at school. And I think that's very good to have good connections with your faculty, with your people that you trust as a mentor, to ask for their guidance, ask for their experience. It's really important to have good mentors in our field. So, and you helped me a lot in the way, you reassured me you're doing the right thing. You're not doing the wrong thing. And if I was doing something wrong, you were honest to tell me, no, this is wrong. So this is now your chance to, if you have any advice or anything for the newly grads, please share.
Yeah, yeah. Well, you know, you you were easy, Shan, because you're a student and you're crushing it in life. So I'm always happy to provide that mentorship and that feedback because I think mentors are important for us as
Yeah.
professionals and as people, right?
Yeah.
So that's something I really enjoy my 24 going into 25 years of teaching and maintaining that it becomes faculty to student relationship, but now it's colleague relationship. I enjoy that back and forth and that mentorship because I've been out almost 30 years and I have a lot of experience. And while your situation might not be, the exact same,
Yeah.
maybe it's something similar I've experienced. So, yeah, some of the advice, like you and I talked about a little bit was, continuing learning and growing. And there's a lot of ways to do that. You can do that inside a practice where you learn how to run the business and learn the right things and wrong things to do from, a human resources
Yeah.
aspect, firing and payroll and, all of that. Again, the dentistry becomes easier because it's about repetition, right? And sometimes the harder part is the HR and running an office. So but continue learning inside and then outside, and be curious. Take CE courses on things that you might want to learn about. You know, a lot of former dental students or new grads complain, "Gosh, I didn't learn that in dental school."
Hmm.
Well, you learn everything in dental school. That is just literally impossible. Um, Dental schools provide a base of knowledge. You start honing your skills, and then afterwards, the learning continues from day to
Yeah.
day, week to week, from year to year. I am 30 years out almost, and I'm still learning like every single week. So, so be curious. And if there's a topic that you really want to learn about that you might have brushed on in dental school, but you want to dive deeper, great. Take a CE course, or, go to a hands-on course,
Of
or,
course. Hmm.
listen to a podcast, or,
Listen to
go on
Dentists on Air.
YouTube. Yeah, exactly. Yeah, so I would say just keep up that curiosity,
Hmm.
and you're most traditional dental students are younger when they get out
Yeah.
of dental school. You are young. You may or may not be in a relationship. You may or may not have kids, and while you're young and have like lots of energy, you need to work really hard and just put in the time, because you have probably a lot of debt from dental school. You might want to buy a nice car, a nice house or condo. It's the time to really put in that hard work. And yes, there needs to be a work-life balance, but you need to give a lot to your profession at the beginning because you have quite a bit to learn. So I would say the advice is work hard, but at the same time, again, if you have all those loans, you need to save too. Save
Yeah.
from the beginning as far as retirement, because compounding is a real thing. Even if it's, 50 or $100 a month, whatever the value is, start saving for retirement because it
Yeah.
really does start going by very quickly, and you want to retire at the optimal time,
Yeah.
and
So
enjoy
you can enjoy
life.
life. Yeah.
Yeah, exactly. So, there's no number of retirement or when you should retire. I'm 54, so I have a decent number of years left in me. I'm really enjoying what I'm doing,
Yeah.
and I don't want to retire anytime soon. I think I would be bored. So I love travel.
Yeah.
I think that's something that I'd love to do more if I work less. But yeah, but save from the beginning, because when you save and you put that money away, you will be thanking yourself, your 20 something or 30 something self,
Yeah.
that started saving early. So and I'd say probably one other thing for new dentists, and I don't know how you feel. We talked a little bit about our relationship and mentorship, and you reaching out to me and helping you out. I think when you're out working in a private practice or whatever your setting may be, the value of networking,
Hmm.
networking with colleagues, networking with companies. There's such a great value to networking. You can't really put a value on, or a price on that networking, but
Yeah.
you know just don't know what opportunities may come up from networking with somebody or some company. So don't stay in your private practice and not talk to people and just be all caught up in running your own practice, or just you don't put blinders on, right? You
No.
have to
Yeah.
like uh, be out in the world and talk to other people. That's how you if you're not happy at a job, that's how you can find other jobs through networking.
Yeah.
Or, hey, I didn't know this procedure before. Again, those that the networking can also open up possible mentorship for somebody. So
100% agree. I feel the new strength or the new most important thing in our world, if you want to be successful, is to have good networking and good connections. Yeah, 100%
yeah.
agree on that. Yep.
So
Well,
and I'll put a plug in too, because as you know, I'm very involved with organized dentistry.
yeah,
Organized dentistry is, in Michigan here, it's my local dental society, as well as the Michigan Dental Association, and then the American Dental Association.
yeah,
And every state has their dental association, and every county does. And that's a form of networking, is being part of organized dentistry,
yeah,
and being part of that voice to advocate and to do the best, what's best for the community and what's best for patients. So being a part of organized dentistry, I think, is just going to strengthen dentistry as a profession.
yeah. 100% agree. Well, thank you, Dr. Edwards, for your time and this
Thank you.
beautiful talk. Really enjoyed having you here on Dentist on Air, and hopefully we'll have you back sometime soon so we can talk more.
I'd love to. I'd love to. Thank you, Cheyenne.
Yeah. Cheers. Have a good one.
Please fasten your seatbelts.